The Minority Caucus in Parliament has called on the government to release funds to the National Health Insurance Scheme to enable the authority to pay its health service providers. According to them, the NHIS already has funds generated from SNIT contributions and NHIS levy, which should immediately be transferred to the National Health Insurance Authority. At a news conference in Accra, the minority in Parliament described the undue delays in payment as an impediment to the effective running of the scheme.
In 2003, the Kufuor administration introduced the NHIS to enable Ghanaians have easier financial access to health care, especially the poor and vulnerable. The Mills and Mahama administration added on to the scheme with the aim of ensuring that one's financial status is not a hindrance to accessing the needed health care. The scheme has made some modest progress over the past decade, but is far from achieving universal health coverage. Its membership dropped from almost 65% in 2008 to less than 35% in 2012. This is why the minority in Parliament have met to discuss and find ways to overcome the problems. Their main concern is the non-payment and sometimes delays in the payment of healthcare providers, which makes quality healthcare delivery in the country out of reach.
This bizarre handling of the health insurance scheme has culminated in the suspension of services to NHIS clients by the Christian Health Association of Ghana, CHAG. The NHIS is indebted to CHAG member institutions for an average period of 5 to 6 months. The hospitals and clinics are unable to meet their financial obligations, in particular payment of salaries of non-mechanized staff. Patients are compelled to take prescriptions to purchase medicines from private pharmacies and chemical shops outside the hospital premises, even in emergency situations.
The minority also mentioned the high cost involved in providing healthcare, which is affected by inflation and currency depreciation. They added that the NHIA is delaying in reviewing tariffs and prices of medicines covered under the NHIS benefits package.
Just today, Chamber of Pharmacy have announced that they have withdrawn services from NHIS. That means even if you go to a hospital, your prescription, your drugs are not part of the national health insurance. So unfolding in front of our eyes is the NHIS collapsing.
According to the minority, the current capitation module of payment to healthcare providers is also defeating the national policy on primary healthcare and reducing geographical access to quality health services in rural communities.